This teachable moment is brought to you by the Jewish Healthcare Foundation and the Pittsburgh Regional Health Initiative. Studies show that a significant number of medical errors occur during handoffs. A team from UPMC Presbyterian standardized the procedure for interhospital transport with their Ticket to Ride program.
Prior to the Ticket to Ride being implemented, our process was fairly loose.
Is the guy going X-ray?
Yeah, it's charged right there.
We noticed that patients were being transported from one location to another, from their home unit to another location for testing or a procedure, and that there was not a consistent handoff of the patient in all instances, leaving the opportunity for errors to occur. We had situations where patients ran out of oxygen while they were transporting because we didn't identify how much oxygen they needed for the transport. We met as a team once a week to design and develop the process. Process improvement works in healthcare because there are so many variables in a patient, in the environment, that the standardization of process is a very good way to ensure that things happen the way that we want them to every time.
You all ready to go? Is the ticket to ride?
It's the ticket.
Okay.
In our new Ticket to Ride process, the nurse does an assessment of the patient's condition prior to transfer to assure that they are, in fact, medically stable and ready for their transport.
Okay, miss, we're ready to go.
All right, thanks, Karen.
If you don't mind, could you tell me your date of birth?
The escort personnel arrive on the unit to pick up the patient, and the health unit coordinator then hands the escort personnel their Ticket to Ride for that patient.
Okay, you're Mr. Perret.
The transportation checklist includes the identification of the patient, checking the assessment to make sure that the patient is medically stable for transfer, checking the oxygen, which was one of the things that we found to be a key culprit in off-unit adverse events. At the testing area,
Morning.
Morning.
This is Mr. Perret.
they hand off face-to-face the Ticket to Ride and the patient.
Hello. Hi, welcome to Imaging Services. My name is Marla.
Here's Mr. Perret's chart. We already notified transport.
Okay, thank you very much.
You're welcome.
Hi, Beth.
Okay, hang on.
Here's Mr. Perret's
All right,
chart.
thanks.
He remains on oxygen at 4 liters flow.
Okay.
When they arrive back on the nursing unit,
Okay, Mr. Perret's back.
the escort personnel hands the ticket back to that health unit coordinator, who identifies that that patient has arrived back on the unit and notifies the nursing personnel that the patient has arrived in order for the patient to be taken back to their room. We piloted our process on one unit to begin with. We were able to spread it throughout our hospital and then subsequently throughout our health system.
With 12 to 15,000 patient transports a month here on the UPMC Presbyterian campus alone, we had to look at a process that included standardization. And with its strong emphasis on standardization, the Ticket to Ride really made it easy for the caregivers to do it the right way every time. And that's really the hallmark of an improved process.